If you want my 5 tips for health anxiety, especially if you have a medical condition that is concerning you, this is the episode for you. Welcome to Your Anxiety Toolkit. I'm your host, Kimberly Quinlan. This podcast is fueled by 3 main goals. The first goal is to provide you with some extra tools to help you manage your anxiety. Second goal, to inspire you. Anxiety doesn't get to decide how you live your life. And number 3, and I leave the best for last, is to provide you with one big, fat virtual hug. Because experiencing anxiety ain't easy. If that sounds good to you, let's go. Hello and welcome back, everybody. Today, I'm going to share some updates about a recent medical issue I have had, and I'm going to share specific tips for dealing with health anxiety. A lot of you who have been here with me before know I have postural orthostatic tachycardic syndrome. I also have a lesion on my left cerebellum and many other ups and downs in my medical history where I've had to get really good at managing my health anxiety. And I wanted to share with you some real-time tips that I am practicing as I deal with another medical illness or another medical concern that, I wanted to share it with you. So here I'm going to share with you 5 specific tips, but I think in total, there's like 20 something tips all woven in here. I've done my best to put them into just 5, but do make sure you listen to the end of the podcast episode because I'm also going to give some health anxiety journal prompts or questions that you can ask yourself so that you can know how to deal with health anxiety if you're experiencing that at this time. So before we get into it, let me give you a little bit of a backstory. Several months ago, I think, I did share that I've been having these what I call surges. They're like adrenaline surges. They wake me up. My heart isn't racing. It's not like it's racing fast, but the only way I can explain it is I feel like I have like a racehorse's heart in my chest, like this huge heart that's beating really heavily. And of course, that creates anxiety, right? And so then I would question, like, is it the heartbeat or is it just my anxiety? And you go back and you go forward trying to figure out which is which. But because this was a symptom that was persisting, and was also showing up when I wasn't experiencing a lot of stress or anxiety, I thought the right thing to do is to go and see the doctor. So I guess really tip number 1, even though we haven't started here yet, really the tip is make sure you're not avoiding doctors. Make sure you're not dismissing symptoms. We do have to find a very, very wise balance between avoiding doctors, but also not overdoing it with doctors. And we'll talk about that a little bit here in a minute. But first, I wanted to just share with you, for me, what health anxiety feels like. Because for me, I'm very, very skilled at identifying what is anxiety and what is not. I've become very good at catching that by experience, folks. It's not something that comes naturally, but by experience, I can identify what is health anxiety and what is a real medical condition or what is something worthy of me getting checked out. And for me, it was, for the health anxiety piece, it's really this sort of anxiety that is a sense of catastrophization. And it's usually in the form of thoughts like, what if this is cancer? What if this is a stroke? All the worst case scenarios. What if this is life-threatening? What if I miss this and you are responsible? You should have picked it up. Like, these are very common health anxiety intrusive thoughts or health anxiety thoughts that I think you really need to be able to catch, right? And be aware of and be mindful of. So first of all, that is the biggest symptom for me. The other thing is when you have health anxiety, you do tend to hyperfixate on the symptom and all of the surrounding symptoms that are sort of going with that. And then you can catastrophize those, right? Like, well, my heart's beating really heavily and I feel dizzy. Oh my gosh. And I've been having a headache. Yeah, you're right. I've been having a headache. Oh my gosh. And then before you know it, you've gathered, I call it gathering. That's not an actual clinical term, but I do use it with my clients, is we gather data that is catastrophic to make it seem like, yeah, we actually have a really big point. And this is actually a catastrophe. Some other health anxiety symptoms that I experience is panic. Is when you notice a symptom, it is very common to start panicking. And then you go back to, is it the chicken or the egg, or is it the horse or the carriage, in terms of, I'm panicking and now the panic has all these symptoms, and are these symptoms an actual medical condition, or are they actually just anxiety and panic? And you could spend a lot of time stuck in that cycle trying to figure that out. And so let's now talk about how to manage these symptoms and some tips and tools that you can use. Okay, so tip number 1 for health anxiety is, drum roll, because you know this, but this is very, very important, is no Googling. Okay, so let me tell you what has recently happened to me. So I've been having these symptoms. I made an appointment to see my cardiologist. It was like 2 months out, and I was like, it's not a big deal. I can handle these symptoms. I'm feeling super confident about my ability now to just ride out some pretty uncomfortable sensations and not catastrophize. So I go in for my checkup. They do an echocardiogram, and it's taking a long time. And she's asking me these strange questions like, so why are you here again? As she's doing it, right? She's checking, she's like looking, she's squinting at the screen. Why are you here again? What are your symptoms? Click, 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 looking at the heart, whatever. And again, I'm in my mind going, Kimberly, like, let your brain have whatever thoughts it wants. We're not going to catastrophe. And I was doing really, really well. And I got up and I answered her questions. I did the whole appointment. She, cleaned me off when I was done and said, great, you've got 24 hours and then the doctor will email you with your results. And then yesterday afternoon, I get a call from the nurse saying, we need to book you a video appointment with the doctor to discuss your results. And as you can imagine, my brain went berserk, right? My health anxiety thoughts were saying, this is really bad. Why would he need to make a video appointment? This can only end badly, right? Like, this must be cancer. This must be heart problems. Am I going to have a heart attack? And so forth. And so, of course, my brain did that. I'm grateful my brain does that, because that's my brain being highly functioning and aware. But the number one rule I made with myself in that exact moment, even though that was very anxiety producing, is no Googling. Kimberly, you are not allowed to pick up the computer or the iPhone and Google anything about this. And so that is tip number 1 for you. I'll tell you why. And a lot of my patients say, but why? It's no harm. I'm not doing any harm. And I'll say, yes. The truth is, now that I've had my appointment, I've actually just seen my cardiologist, but now that I've had my appointment, he encouraged me to do a little research and what was hilarious to me is every single website is different, and some catastrophize and some don't. Some go, this could be very normal. Other ones say, this could be cancer, 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 cancer. So this is why I'm telling my patients all the time, don't Google, because what you read is different. It's not like this is going to be a factual thing. Most of the time, people who have articles that rank high on Google searches are ones who have optimized their website to be very easy to Google. And the reason they have become number 1 on the Google algorithm is because they've included keywords like cancer for blah, blah, blah. And, all of these health issues and health names. They're the ones that are at the top. Some of them are very reasonable and helpful and accurate, but a lot of them are not. They've just really done a great job of putting in lots and lots of keywords. right? That make them highly searchable and come up high on the algorithm. So please, number one, do not Google. Go to your doctor for questions if you have any. Unless they've encouraged you to do research, do not Google. Okay. Tip number 2, I've actually categorized this in a bigger category, and I've called it Important Health Anxiety CBT Techniques, because there is some important CBT tools that you're going to need here. And here we'll go. So while I was in getting my echocardiogram, I was laying and I was having some anxiety because she was like squinting and asking some strange questions and not in the normal of what I'd experienced. And I could feel the pull to check her face for reassurance. Like, does she look concerned? Does she look relaxed? What's going on with her? I wonder what she meant. And so what I want to encourage you to do is acknowledge and catch when you're checking their face to try to decipher what the nurse or the assistant or the doctor is doing and saying. Because really, all I'm doing there is mind reading, because I have no idea what she's thinking. I don't know if I was laughing at myself because she was squinting and sort of looking concerned. And I was like, I wonder if she's trying not to pass gas, right? Like we could mind read that she thinks I have cancer and that there's a big problem, or maybe she's just trying not to pass gas right now. Maybe she's thinking about a fight she just had with her partner. Like my attempt to analyze her facial expression is a complete waste of my time. So you can use that tip anytime you want. The next tip for you is no reassurance seeking with nurses or doctors. Now, I actually fell almost into this trap. If I'm being completely honest, I did fall into this trap, but I caught myself really quickly. So as she was finishing up, she takes off her gloves and she's like getting ready to like discharge me. And I said, so you'd let me know if there was, and what I was going to say, I paused. Because what I was going to say is you'll let me know if there's something wrong, right? I was going to say that. And then I was like, no. And then I stopped myself and I said, you know what? I know the deal. I've done this enough times. I know I have to wait for the doctor. But I caught myself wanting to get confirmation from the nurse. And I already know that nurses are not allowed to give me any diagnosis anyway. I caught myself wanting to get some expression of relief from her, like, no, you're fine, everything looks good, or whatever. Sometimes they accidentally give you that reassurance. But I caught myself seeking reassurance from her. And in addition to that, let me talk to you a little later about how we do that with doctors as well. Often, if you're in the office with a doctor, you may find yourself at the end of the session going, I'll be fine, right? Like, it's not bad, right? And it's okay. We're all going to ask some of those questions. Like, I'm not going to be the reassurance seeking police with you. But what I want you to do is really drop down into catching when we're engaging in reassurance seeking and using it too much to reduce our own anxiety about it, to take away our own anxiety or fear. Now, another CBT technique or sort of rule that we often set in clinical work when I'm talking with my clients who have health anxiety is also not swaying the doctor or the nurse to answer things in the way that you want. And a lot of people fall into this trap. So for me, I just had my doctor's appointment. We are working through and there is some little problems that we will work out. But I caught myself there too, wanting to sway him to be very positive. Like we had talked about, ultimately, he had said it could be, there are some issues. It could be this, it could be that, it could be this. So he listed off like 3 or 4 options. Some were like very, very small. And of course, the third one is always like, it could be cancer. They always say at the end, like, or whatever, And so when they give you these 3 or 4 or 5 options on what the problem might be, it's very important that you be mindful and aware of how you're trying to sway the doctor to give you certainty. Because this is what my doctor said. And I'm going to be brief. I'm not going to bore you with my medical stuff. But he'll say, it could be that you recently had, COVID or an illness or a virus. It could also be this other condition, which is common. And if it's so, we'll treat that. It could also be that there could be some, in my case, he said like rheumatoid arthritis. And that's sort of a longer treatment. And then the final thing, which we don't think so, but it also could be cancer. So let's say he lists off these 4 options. Now, this is very common. Doctors will do this often because their job is to educate us on all of the possibilities so that we can create a treatment plan that doesn't ignore big issues. But we have to be careful that we don't spend their time and our time going, you think it's the first one, right? It's probably just the first one. I probably just had a virus, right? And I'm really swaying him towards giving an answer when he's already told us that he or she doesn't know yet. He's already said, I don't know yet. We're going to need to do extra tests. And so catch yourself trying to get them to reassure you and confirm that it's definitely not the C word. The cancer word is what I'm saying there. And so catch yourself when you're doing those behaviors in the office with either the nurses or the technician or the doctors. Very, very important. Now, one other thing I want you to also catch is if you're coming to them with something, let's say you are coming to them with a concern that you pretty much know is your health anxiety, but you want reassurance that it's not. Also be careful that you don't overly list things to sort of convince them that something is wrong. A lot of you don't do this, I know, but I have had a lot of clients who've come back to me after seeing the doctor and said, he would say, do you have any other symptoms? And they would list even minor symptoms that they had a month ago that they knew had nothing to do with it, but they felt like if they didn't say it all, if they didn't include every symptom, every stomach ache, every headache, everything, that they could miss something. So also keep an eye out for that. Okay? So that's some sort of overall general CBT techniques we use for health anxiety that help guide people into not engaging in those health anxiety compulsions. Okay, tip number 3 on how to manage health anxiety is really talking now about health anxiety help before your doctor's appointment and while you're in the doctor's office's waiting room. This is a really important part of it. So from the minute that I got the call from the nurse that he wanted a quote unquote video call with me, my mind went to, again, the worst case scenario. It just does. It just does. And I think that is actually really, really normal. I really do. I think that is what happens naturally for anybody, right? So first of all, I don't want to even go too over in terms of pathologizing that. I think that's a normal thing for anybody to experience. And so the first thing I want you to practice is validating your anxiety. It's a part of self-compassion practice. So it's it makes complete sense, Kimberly, that this is concerning you. That's one of the most important self-compassionate, statements you could make for yourself. It makes complete sense that this is hard, this is scary. Of course it's making you uncomfortable. It's validating. You might even move to a common humanity and going, anybody in this situation would have anxiety. Then you can also move into mindfulness skills, which is, this was one that I hold very true, is just because I feel anxious doesn't mean there's danger or there's a catastrophe. It's my body's natural response to create anxiety when it feels threatened. That keeps me alive. That's a good thing. But just because I'm anxious and having thoughts about scary things doesn't mean they're facts. Remember, thoughts are not facts. The next thing here is also being able to just observe them. Again, while you're sitting in the waiting room, they were playing the movie, what's it called? Moana, right? And I love Moana. I remember watching it as a child. And so I'm sitting in the seat and my mind is offering me all of these health anxiety intrusive thoughts. And my mind really wanted me to pay attention to them. And so a part of my mindfulness practice was to go, I am noticing I'm having these catastrophic thoughts, but I'm also noticing Moana. And I'm going to choose which one I give my attention to. I'm not going to push them away. I'm not going to make the thoughts go away because they're naturally going to be there. This happened again, I basically knew from yesterday afternoon until 9 a.m. this morning, I knew the thoughts were going to be there and I accepted them there. I accepted that they would be. I didn't go in saying, oh gosh, I hope the next 24 hours aren't filled with thoughts. I was like, they're going to be. Hello, thoughts. Welcome. I know you're going to be here, right? And I'm going to train my brain to put attention on what matters to me. And in this case, I'm not going to make these thoughts important. I'm going to watch Moana. I'm going to look at the colors. I'm going to listen to the sounds. I'm going to notice whatever it is that I notice. I'm going to notice the fabric of the seat underneath me as I'm waiting in the room. Last night as I went to bed, I'm just going to notice the feeling of the cushions underneath me. This is mindfulness. And this is so important, being present and paying attention to what is currently happening instead of the worst case scenario. So there's one important point here, which is my mind kept saying, by 9 o'clock tomorrow, your life might change. You guys know it. If you're listening, you totally, I'm guessing, know what that's like. You're like, after this appointment may change your life for the worse. And my job was to go, maybe not. It could be that he just wants to tell me everything's okay. It is what it is. It will be what it will be. I will work through it and solve it when it happens. I'm not going to live the next 24 hours or the next 12 hours coming from a place of the worst case scenario until I have actual evidence of that. So we're not going to live your life as you wait for your appointment. We're not going to live your life through the lens of the worst case. We're going to live through it through being uncertain and accepting that in this moment, nothing is wrong. Until we know, we don't know. Right? Until we know, we don't know. Now, other options for you, I'm just going to add a couple here, is you can also, I have found meditation for health anxiety to be very, very helpful, particularly when health anxiety is taking over. Like that has been very beneficial for me, is to, find a meditation that can actually sometimes give me some concrete skills to use in the moment to stay, present. We're not goaling towards staying calm because maybe you're going to have some anxiety. That's okay. Really what we want to do is we want to be working in the most skillful fashion as we can. And then the last one, this one's a little controversial. Some people don't agree with this piece of advice, so kind of take what you need and leave what doesn't help. But for me, when I'm anxious, I tend to shallow breathe a lot. I hold my breath a lot. So for me, it was just reminding myself just to breathe, not breathe in any particular fashion or deep breathing, but just be like, take a breath, Kimberly, when you need. Take a breath when you need. Okay. So tip number 4 is what to do when anxiety takes over in the biggest way. And that ultimately means what can you do when your brain is setting on the full alarm? Now, in this case, I'm just going to say it's basically what to do if you're panicking. And the advice goes the same as it is whether there's a health anxiety panic attack or a regular non-health anxiety panic attack, which is do not try to push the anxiety away. So let's break it down. If you're having anxiety and you're saying, this is bad, I don't want it, it shouldn't be here, you're actually telling your brain that the anxiety is dangerous, not just the health issue, but also the presence of anxiety is dangerous, which means it's going to pump out more and more anxiety because you've told it that anxiety is dangerous. Your job here is to let the anxiety be there. Try not to push it away. What we know is what you try to push away comes stronger. you can talk to your anxiety. There's actually research to show that when you talk to your anxiety and you talk to yourself in the third person, it can actually empower you and feel more of a sense of empowerment and mastery over that experience. So for me, as I actually, unfortunately, I've had quite the 24 hours. We actually had a very large earthquake last night here in Southern California, which woke me up. So I had some anxiety related to that. And then, of course, my brain was like, oh, yeah, and by the way, you might have cancer. Ha, ha, ha. You know what I mean? Like, of course, your brain's going to tell you that. And so in that moment, I used the skill and the research around talking to myself in the third person. So I said, Kimberly, there's nothing you can do right now. It makes total sense that you have anxiety. Let's not push it away. Let's bring your attention to what you can control, which is how kind you are to yourself, whether you're clenching your body up, whether you're breathing, what you're putting your attention on. You can't control anything. You can't control this earthquake. You can't control what's happening tomorrow. All you can do is be here now. And so using a third person, using your name as the third person, like Kimberly, and saying what you need to do, coaching yourself has been incredibly helpful for me. And I know for a lot of people, because that's actually science-based. Okay, the next thing I want you to do, and this is the final one before we go through some questions that I want you to ask yourself, is to engage in value-based behaviors. Now, what that means is when we're anxious, when we have health anxiety, it's very normal for us to want to engage in safety behaviors. Like one for me was every morning I drop my daughter off and my husband drops my son off at school. And I could feel my anxiety wanting to stay home. Like I don't want to go out. And so I almost was starting to have, maybe I'll ask my husband to drop off my daughter and my son so I can stay home. And I recognize that would be me doing a fear-based behavior. I would be doing that only because I don't want to face fear today. I just want to make it small. And number one, it's okay. If you need to do that, that's totally okay. But for me personally, I caught myself and I said, no, you value being someone who drops off your daughter and shows up and doesn't let anxiety win, right? That you love dropping off your daughter. Why would you, if you stayed home, you'd only be kind of like doing the dishes, circling around, maybe catastrophizing, like, just trying to get past time. You love taking your daughter to drop off. And so engage in that. Another value-based behavior for me personally is humor. So I'm texting friends and I'm telling them jokes about, what I'm going to do to my doctor if he says something wrong or something, or I'm making jokes about, what some of the questions and statements that the nurses made. Like I'm making jokes about it, not to catastrophize, not to put them down, not to minimize my own discomfort, but humor is a very big part of my values. I'm making jokes about what we'll do if it's cancer and, will you come to my funeral and silly things. And we're not doing that. I really want to make sure you understand. I'm not doing that as a depressed, like bad things are going to happen. I'm doing it because I'm literally saying, it will be what it will be. Let's just move forward and let's actually bring some light and joy and some laughter to this. Now, you mightn't like that. And if that's not your values, don't do it. But identify what, and here's a question. I will talk you through this here in a minute, but let's talk about it now is what would the non-anxious me do right now? What would I do if this fear wasn't here? And then do those behaviors. It's really, really important that you make sure you hit this in as many ways as you can, because fear can cause us just to clam up and sit still and ruminate. And it's very important that you practice not just ruminating and cycling and going over and over and over and over all of the worst case scenarios, because your brain will take you to some very dark places. Okay, so this is really important. I know I've given you the top 5, but that's more like 20 points is let's talk about some hypochondria or health anxiety journal prompts or questions you can ask yourself to stay as skilled as you can. Number 1, what is in my control right now? What is in my control? My behaviors, my reactions, that's ultimately what is in your control. What's not in your control is how much anxiety you have and what thoughts you have about them. You can then ask yourself, what is not in my control? And you can be very specific here. In my case, it's like, what's not in my control is what the doctor says. What's not in my control is what my health condition is. What's not in my control is when he calls. You know what I mean? What's not in my control is the treatment plan. I'm going to have to wait for him to do that. So I'm identifying what is in my control and what is not. The next question is, how am I going to gain a sense of control that is helpful to my long-term health anxiety recovery goals or my health anxiety treatment plan? So that's a long question, but how am I going to gain a sense of control that is helpful to both my long-term health anxiety recovery goals and my health anxiety treatment plan? So for me, I know that Googling is going to be a false sense of control and doesn't help my long-term recovery. So I'm not going to do it. I know that me ruminating and doing tons of mental compulsions is going to give me a sense of control, but it's not helpful. It's not helpful. It doesn't help my long-term recovery. It doesn't help my long-term mental health. So I'm not going to do it. What will help my long-term health anxiety goals? It's going to be all the tips that we covered today. No Googling, no checking faces, no reassurance seeking, no swaying the doctor, practicing my mindfulness, being as compassionate as I can, maybe taking some breaths. All of those are going to make me stronger in my health anxiety recovery instead of weaker, the ones which would be ruminating and doing all of these, not very helpful safety behaviors. Okay? Another question is, how willing am I to be uncertain right now? You guys, you are going to have to tolerate a lot of uncertainty. That's what this is all about. That's what this is all about. From the minute I got the call from that nurse saying that I needed to have this video appointment, from the minute he got onto the video appointment, all I had to focus on is, am I willing to be uncomfortable? Am I willing to be uncertain? Because the only reason I would have Googled was because I wanted certainty. Really, really important. Next question. What would the non-anxious me do right now? What would the non-anxious me do? She'd get up and she'd go and drop your daughter off. And then she'd call your friend, because that's what you do every Wednesday morning. She'd respond to emails. She'd call up, do whatever it is that you're doing. What would the non-anxious you do? And then the last question is, how can I be kind and gentle towards myself as I navigate this experience? Another code question for that is, what do I need right now that is skillful? What do you need? The most beautiful thing about this is my husband. He is the most gorgeous man. And he sits down. He doesn't reassure me. He just says, I got you. I got you. And if your partner is giving you a lot of reassurance, you might want to mention to them, that actually doesn't help my long-term health anxiety. I just need you to be next to me and support me. And so it's very important that we make sure our partners aren't giving us a whole bunch of reassurance and a whole bunch of, certainty-seeking behaviors that keep us stuck. Okay? So that's it, guys. There are my 5 tips for health anxiety, which turned out to be more like 20, I know, but I try to always over-deliver. And I really wanted to jam in as many skills as I could. Okay? I hope you have a wonderful day. Please do not worry about me. I am actually fine. There's a joke between my best friend and I. We say, are you fine number 1 or fine number 2? Fine number 1 is you actually are fine, and fine number 2 is you're not fine, but you're saying you are. And I am fine number 1. I actually have a lot of faith in my doctors. I have a lot of faith in my ability to handle these things. And these are just another bump on the road in terms of being someone who has postural orthostatic tachycardic syndrome. So all is well. All is well. I am fine, number one. And I hope you are fine, number one, as well. I am sending you so much love. Do not forget, it is a beautiful day to do all the hard things. And I'll see you next week. Please note that this podcast or any other resources from cbtschool.com should not replace professional mental health care. If you feel you would benefit, please reach out to a provider in your area. Have a wonderful day, and thank you for supporting cbtschool.com.